An instructional video for primary healthcare workers on case identification and triage for COVID-19. COVID-19 is a viral infection that affects the respiratory system. The disease can be severe and can lead to loss of life. There is no proven cure for COVID-19, but it can be prevented if precautionary measures are taken. The purpose of this video is to provide guidance on the use of the Triage system for early detection and management of potentially infectious patients of COVID-19 at the primary health care centers. As patients arrive at the facility, they should be told to maintain at least 6 feet from each other in observance of physical distancing. 2 health workers wearing protective gears and a community volunteer should be positioned at the entrance of the facility. The first health worker hands out masks and checks the temperature of all patients using an infrared thermometer before entry at the gate, and they should wear a face mask. All the patients coming in are asked to wash their hands, as the clients with fever are sent to tent 1 or designated area. The community volunteer announces that patients who have cough, shortness of breath, sore throat or body aches should proceed to tent 1. Meanwhile, patients for antenatal care, immunization or other routine PHC services should go to the appropriate waiting area and maintain physical distance. Ensure that all patients sit at least 6 feet apart, and the waiting area for patients with symptoms is at least 18 feet away from those without symptoms. For patients with symptoms, the health worker uses provided guidelines to identify the patients suspected of having COVID-19. For those that do not meet the case definition, direct them to tent 2 or the appropriate waiting area. For patients suspected to have COVID-19, quickly ensure they have a change of face masks properly worn and left on throughout their stay at the facility. Explain to the patient why he or she is a suspected case of COVID-19 and the reason for his or her isolation. Ensure that these suspected cases are kept isolated from the other patients and clients and are not discriminated against. Immediately call and notify the following of the suspected COVID-19 case. 1. Emergency numbers provided by your state for COVID-19 reporting. 2. Disease Surveillance and Notification Officer, DSNO. Or 3. State Focal Person for COVID-19 Disease Notification of NCDC. Keep the patients in an isolation room or corner until an ambulance or any other means of transportation arrives. Do nothing to the patients and do not allow anyone, including family members, into the isolation room or come in close contact. When the symptomatic patients depart from the isolation area, spread the room and clean surfaces that were within 18 feet with disinfectants, such as 50 ml of bleaching agent diluted with 4 liters of water. Discard items that cannot be disinfected. This is in addition to the regular cleaning and disinfection that should be carried out in the entire waiting area. Remember, compliance with preventive measures while providing services is the only way to protect yourself and your patients from getting and spreading the COVID-19. This video is brought to you by the National Primary Healthcare Development Agency in collaboration with Federal Ministry of Health and Development Partners.